Last Saturday marked Dr. Anthony Fauci's final day as the director of the National Institute of Allergy and Infectious Diseases, an agency with a $6 billion annual budget. Once praised for his role as the nation's top COVID doctor, the former White House chief medical advisor now faces increased scrutiny for his handling of the response to the COVID-19 virus. Joining me now to discuss this and more is Dr. Bhattacharya. He's a professor of medicine at Stanford University. He is one of the authors of the Great Barrington Declaration, which advocated for alternative approaches to COVID-19 and was criticized by Dr. Fauci himself and was also taken off of Twitter. And he's back with us and Twitter. Dr. Bhattacharya, welcome.
Nice to be here.
All right. So let me just ask you this question first. How do you view the legacy of Dr. Fauci?
I mean, it's mixed. He's served for 38 years as the head of the National Institute of Allergy and Infectious Disease, and over that time, he's led the agency into some very important advances, including in HIV and a number of other diseases. On the other hand, I think his management of the COVID pandemic has been an utter disaster. He, instead of seeking the advice of other doctors outside, he decided that he himself knew best what to do, that he himself was the science, and that anyone that contradicted him was ipso facto contradicting science itself. And he locked the American people into a path of disastrous lockdowns that have harmed children, that have harmed the poor, that have harmed the working class. He seemed utterly blind to these harms and persisted in this sort of the strategy of suppression long past the time it was clear that it had failed. I think that people are going to look back on these last 3 years in some ways as essentially like undoing whatever good he may have done during his tenure at the NIAID.
I would also argue that he's harmed public health from a standpoint of shaking confidence of the public in the public health arena. What will it take to reestablish that trust from the American people?
I mean, I completely agree with you about that. I think, for instance, early on, he talked about masks as they don't work, he said, and then he said, oh, no, they do work, but I was lying to you. But in fact, they never actually worked. Over and over again, he overstated the vaccine's efficacy against preventing disease. He pushed very hard for vaccine passports. I think new leadership is absolutely needed, and this new leadership needs to repudiate the past leadership. They need to explicitly say, look, this is that tremendous mistakes. Tony Fauci and some of the other leaders of public health made tremendous mistakes during the pandemic, harming people. That has to be acknowledged by the new leaders, the leadership, before any possibility of trust being restored. And the new leadership has to be humble. It can't have a leader that says, look, I am the science. That kind of attitude has no place in public health or science.
So, Dr. Bhattacharya, was this science that was politicized? Is that part of the problem here, that politics entered into this and decisions were made based upon politics and not the science?
I mean, I think that's certainly true, for instance, for school openings. The CDC worked very closely with the teachers' unions, for instance, to keep schools closed, even after the time, long past the time when any of the scientific evidence suggested it was worthwhile. Schools in Europe were opening in 2021, and American schools, especially in blue areas, stayed closed. That was politicization, but it wasn't just politics. It was closed-mindedness and hubris. This idea that he and other public health leaders did not need to listen to outside critics at all. In fact, so much so that they worked to suppress any discussion and criticism of their policies on social media. They worked with big media to essentially lock out any idea that there was opposition, legitimate opposition to their ideas. They used their power, they abused their power to create an illusion of consensus among scientists that didn't actually exist.
Well, an example of that is after you participated in the Great Barrington Declaration, Francis Collins, the former director of the NIH, emailed Dr. Fauci saying they needed, quote, a devastating takedown of you. Now, this doesn't sound like something we should be pursuing in science, of silencing those who have differing viewpoints, as we should be reaching consensus, I would think, as scientists.
Yeah, I mean, I think the key thing there was that you had Francis Collins, the head of an NIH, writing to Tony Fauci, calling for a devastating public takedown of the Great Barrington Declaration. What was missing was actual substantive disagreement. It was just, oh, we are wrong. You must take them down, destroy them, destroy their reputations, destroy these ideas. Don't let these dangerous ideas filter out into the world and let the world know that there are scientists that disagree with us. That is not a scientific. In fact, that's a misuse of their power, a deep misuse of the power of these scientific agencies. And they control the minds of scientists because they control the budgets of scientists. I'm a professor at Stanford University. If I don't get the tenure at Stanford unless I have a NIH grant, and a lot of scientists stayed silent as a consequence of it. It was a deep misuse of their power, a conflict of interest.
Dr. Bhattacharya, we're up against a break, and I know you are, looks like you're ready to take off. Can you stick around for one more question?
Sure.
Okay. 2-minute break. We're going to come back because there's supposed to be a release of the Twitter files this week on Dr. Fauci. And, of course, you are right in the middle of that because you were basically squelched on Twitter. I want to move to this topic of the Twitter files. You've been following that with great interest, I'm sure, because you were specifically on the list of people whose accounts were throttled or shadow banned by Twitter. We now understand that kind of the latest dump we're going to get of the Twitter files from Elon Musk is going to be the Fauci files. What might we expect in those files?
So I'm part of a lawsuit that's been brought by the Missouri and Louisiana Attorney General's office against the Biden administration, along with the New Civil Liberties Alliance. What we found in that lawsuit is that a dozen federal agencies were sending instructions to big tech, essentially about like what to censor, in many cases who to censor. I don't think we'll see an email from Tony Fauci to Twitter saying, block Jay. I think what we're likely to see is communication from the government to Twitter about the content of what should be suppressed and who should be suppressed online, including accounts that were vehemently opposed to lockdown that were throttled as a consequence of this, I think, government action. I think Twitter, in many ways, was not acting on its own to suppress this debate. This was a conscious action by government agencies to try to suppress this COVID debate in the name of suppressing misinformation, when in fact often the government was the biggest source of misinformation during the pandemic on a whole variety of topics.
That's a First Amendment violation.
Absolutely, it is absolutely a First Amendment violation. And this lawsuit that we brought, the Missouri and Louisiana Attorney General's offices have brought, I think is going to show that to the American people. We actually, through that lawsuit, we had a deposition of Tony Fauci. We have a deposition upcoming of Jennifer Psaki, the former communications director of the White House. We already have, as I said, emails from a dozen federal agencies, regular communication with big tech, censoring American free speech rights. The thing about things that's most important, Tony, is that it's not just that they censored that, which is a violation of rights. That's important, but that had consequences. Your kids were blocked from going to school. Businesses closed, churches, mosques, synagogues closed as a consequence of these decisions, and people died as a consequence of that suppression of information.
And it wasn't just suppressing, as they tried to make people believe it was just kind of the radical folks that were out there on the fringe that they just didn't want to scare people. I mean, you have, like yourself, academics, professionals who are just engaging in the dialogue and the discussion of trying to get to real-life solutions that would work. And they silence them. This is dangerous, extremely dangerous, not just for the First Amendment, which is extremely troubling, but just from the standpoint of the overall health of the American people when it comes to issues like COVID.
You're absolutely right. I mean, that's the thing, is like free speech, it's of course important in the abstract, but it's even more important during a pandemic. When you have a time of deep uncertainty about science, about COVID, about infectious disease policy, you need as many minds as possible talking together, trying to figure out what the right truth is. You had this hubris on the side of the government, on the side of Tony Fauci, saying, oh, I have the solution. I know what it is, so much so that I can stop other people from talking because everyone else talking is dangerous, not me. That itself was dangerous, and we have to make sure that it never happens again.
You're
put
absolutely
constraints
right.
on the American government.
You are absolutely right, and we look forward to the revelations coming forth into the success of these lawsuits. Dr. J. Bhattacharya, thanks so much for taking time to join us today. Always great to talk with you.